So we're at the transfer center is actually, so Memorial Hermann has 10 acute care facilities. And the mothership, if you will, is our Texas Medical Center facility. It's the level 1 trauma center. And the transfer center is located in the Texas Medical Center adjacent to Life Flights. Anyone that wants to transfer a patient to any of our facilities, so it can be from a non-Memorial Hermann hospital, a freestanding ED, or a long-term acute care hospitals, they will call the transfer center. The transfer center will do an intake, get the information from the caller, ask the caller and determine what type of bed placement the patient may potentially need, and then after we do the intake, then we check our bed capacity at the referring facility in which they're interested in transferring the patient to. So they may not want to come to the medical center. They may want to come to one of our hospitals, say that's located in Katy or the Woodlands or Memorial City. But the caller typically tells us which facility they would like the patient to be transferred to, and we take it from there. When they initiate the transfer, my team, we're actually inputting that information into a call from from Forefront. So if they're telling us it's Betty Smith, we're inputting the information as the caller is speaking to us. The neat thing is that if it's from one of our sister facilities, we have an HL7 interfeed. So if we type in the name and we look for the date of birth, if it's a patient that has been in one of our hospitals, it will automatically pull up that information for that patient. So we don't have to pull in additional demographic information. But with intake, all of our information is entered into the call queue, if you will, when the caller makes the initial call. And so we're able to, track the exact real time of the phone call, physicians as they're being paged, bed requests. It's really very beneficial for us in our process. Now, I mentioned earlier that we have 10 sister facilities, and of course, everybody is interested in transfer data. Interested in what kind of patients are coming into me, what is the payer mix of those patients, who are our top referring facilities. And so I generate reports actually monthly that are distributed to our executive leaders, actually to the C-suites in each one of our facilities. So for give you an example of reports I'm able to generate based on the information that the team inputs into Forefront. So a denials report. So we want to see denials, the reason for the denial, the date of the denial, the time of the denial, what service was involved. So we can actually track when we have capacity denials and determine, so we seem to not have enough, say, neurosurgical beds. We're frequently having to deny for capacity reasons for neurosurgery. That's an example of one report. I pull reports for and look at total transfers, so I can look at the number of patients that were accepted, canceled, or denied. We pull reports and look at our pediatric population. How many PD patients are coming in. The data fields in Forefront are such that it allows us to capture our top referring facilities. We can look at the payer mix of those facilities. It's also being used as a marketing tool, if you will, because with that data, then I'm able to determine which referring facilities do I want to go out and encourage to, partner with us and send their patients to us. Since I came in after it had been launched, I needed additional training. And Scott and the team members were very helpful in helping me with learning the reporting tool and showing me the different features that I wasn't really aware of that were available to me in Forefront. For example, the bed request. We initially, the team was inputting our bed request in a separate application. And then Scott and the team showed me how we could utilize bed requests, how we could utilize the health facts so that we cut down on some of those dual processes that take up additional time and just utilize the tools that we had directly in Forefront. Well, our leadership, has definitely seen the value of the transfer center. What we've seen is a increase in the number of transfer requests. We have a one call does it all pretty much process. And so the referring facilities have kind of figured out that, it's the process is easier with Memorial Hermann. Not necessarily means that we always say yes, but the process is always easier to get an answer in a timely manner. So from a volume standpoint, our leadership is excited about that. The fact that the Transfer Center team is knowledgeable in EMTALA and the Texas hospital transfer laws help us stay compliant with regulatory agencies. Sisters now call the transfer center, sister facilities, and we help them figure out another sister facility to send a patient to versus out-migration to a non-Memorial Hermann entity. You have to make sure you get your executive team involved in the process, your physicians engaged, and really take your time to roll out the transfer process as you get ready to go live. I spend 6 weeks with the sister facilities, weekly meeting with them, talking about the transfer it's a standard process, but just so that they understand it, offering them a transfer review. So that would be, I guess, a piece of advice I might offer to anybody who's seeing this. When you embark down the road of a transfer center, take your time and get all the stakeholders engaged, and I think you'll be very successful if you do that.